The coordination team organizes and plans the vaccination campaign. Before starting the campaign, it's essential to set up the cold chain. Choose and prepare the vaccination sites. Identify and train the vaccination teams. Inform and raise public awareness. Organize transportation, supply and stock management. Organize campaign administration. Plan waste collection and disposal. When responding to an epidemic, it's important to continue collecting epidemiological data and to ensure an uninterrupted supply of treatments for declared cases. The cold chain is the key element that guarantees the quality of administered vaccines. Setting up a cold chain means being able to produce ice and to store vaccines. One qualified person is responsible for the cold chain's quality performance. If new refrigerators or freezers have been ordered, they must be positioned vertically upon arrival so as to stabilize the refrigeration fluid. They must only be switched on a few hours later. The refrigerator and freezer user manuals contain technical and practical information. They're needed to calculate daily ice production or the number of vaccines or ice packs that may be stored in the unit. Freezers are used to produce ice. They must be started a few days before the beginning of the vaccination campaign so as to produce a rolling stock of frozen ice packs sufficient for needs throughout the campaign. The ice packs must be checked. They should be 4/5 filled with water, then positioned vertically in the freezer so that all of them are in contact with the freezing surface. Freezer performance is optimal between temperatures of -15 and -30 degrees Celsius. It's essential to be precise when estimating ice pack requirements, both per day and for the whole duration of the campaign. Ice pack needs depend on the size of the target population, the number of vaccination sites, the number of teams, the recommended transport, the outside temperature, the cold chain and storage facilities of each site, and the duration of the campaign. Sufficient ice production must be guaranteed each day, as well as sufficient capacity and volume to refreeze used ice packs. A rolling stock system is put in place. The vaccination teams are supplied with frozen ice packs in exchange for unfrozen used ice packs that are put back into the freezer. The freezing capacities of the freezers are used to estimate the number of ice packs that can be frozen each day per appliance. A chart showing the number of ice packs required per site and per day facilitates the organizing and planning of this task. Refrigerators are used to store vaccines. It's important to be sure that they've been set up correctly. The refrigerator should not be put up against a wall. A space of at least 30 centimeters should be left behind it to allow good air circulation. It's not recommended to set refrigerators up directly on the ground. Ideally, they should be on pallets that have been checked to be level and away from sources of heat. Each appliance must contain adequate temperature monitoring material. A stopwatch card is put inside each refrigerator, as well as a monitoring thermometer. A temperature monitoring sheet is stuck on the door. If new refrigerators are installed, they need to be started 24 to 48 hours before the arrival of the vaccines. The refrigerator temperature must be between 2 and 8 degrees Celsius. The type and quantity of vaccines is checked upon arrival and compared with the order form. The quantity of solvent is also checked, making sure it corresponds with the number of vaccines delivered. Vaccine packaging is checked, as is the presence of a temperature control chart or an electronic temperature recorder, which records the temperature throughout the transport period. The individual excess temperature indicators are checked too. Storage information and recommendations are also checked on the manufacturer's instructions notice that comes with the vaccines. The vaccines are stored, leaving the expiry date visible, and vaccines with the nearest expiry date are stored in such a way that they are the first to be used. A stock card is filled out, which must contain the name of the vaccine, giving both the international non-proprietary name and the manufacturer's name, the dose and type of presentation, the batch number and the expiry date. Incoming and outgoing stock movements are noted by dated entries, including the origin or the destination of the item. Each stock movement entry is noted on a separate line. Vaccine quantities are recorded in numbers of doses, not in numbers of vials. Solvents are not stored in the cold chain. However, they are refrigerated at least 12 hours before use, so that they're at the same temperature as the vaccine powder at reconstitution of the vaccine. The stock cards are read to check that the number of vials of solvent used tallies with the number of vaccines. Solvent should never be stored in freezers. If the vaccination campaign involves the administration of more than one type of vaccine, separate refrigerators for the storage of each vaccine must be put in place. Food or drink must never be stored in refrigerators used for vaccination material. One person only must be in charge of the cold chain. This ensures his complete control of its management. The person in charge of the cold chain manages ice production and vaccine storage. He supplies ice packs using a rotational system. He prepares vaccines and solvents for the vaccination teams. He checks the temperature of each appliance twice a day. A temperature control chart is visible on each appliance. Any equipment breakdown must be recorded and adequate measures taken with specialist advice in case of cold chain failure.
Tous les frigos, il faut les brancher un par un, parce que chacun prend beaucoup d'énergie quand il démarre.
A second person must be identified and trained to replace the cold chain manager in case of illness or absence. The person in charge of the cold chain may also manage the vaccination material stock. Contact with the local authorities is essential, so as to inform them of vaccination activities and to ask for their help in the selection of vaccination sites.
Merci beaucoup. À très bientôt.
Vaccination sites must have certain characteristics. They need to be accessible and well known to all, cover a population of 15 to 20,000 people in urban areas, have two distinct entry and exit points so as to facilitate the movement of people and to avoid crowd confusion.
Il y a une entrée, mais il n'y a pas de sortie après. C'est une classe.
It must allow for easy movement of both vaccination teams and the population without being too vast, as it then becomes difficult to control movement.
On va là-bas, on identifie un site où on peut faire J1, J2 et J3, éventuellement les faire ici.
A sufficiently large and shaded waiting area is preferable. Existing physical constraints, walls or fences, are used to facilitate sorting and crowd management. In urban areas, well-known sites like schools, places of worship, and village halls are used if available. Sites can be close to a market, but should avoid the central marketplace itself. In rural areas, a tent or the village chief's house may be used, or temporary shelter built for the campaign. Vaccination campaigns should not be carried out in existing health centres, so as not to disturb normal activities or patient care. Proposed sites must be visited with the local authorities to select those best suited for vaccination.
Vous vous limitez là seulement sur
Voilà,
l'arbre.
sous l'arbre, exactement, voilà, c'est ça.
Vous allez travailler sans problème.
Ok.
During these visits, a map is drawn up of each of the possible vaccination sites. The practical organisation of the site and the logistics material required to set it up are planned using these drawings.
Sécurité, je verrai plutôt la sortie du site là-bas. On va installer les tables ici, au milieu. Donc on aura ici les deux rangées de tables, avec les gens dos à dos.
During these visits, inquiries should be made as to any available material such as tables and chairs, and to see if there's a storage site available. We also see whether people would be available to participate in vaccination teams. For each site, the vaccination circuit must be meticulously organised. A waiting and sorting area is set up just before the entrance to the site, where registration takes place. From here, people are directed to the vaccinator. The preparer's work area must be close to the vaccinator, but set slightly aside so they can work without being disturbed. The head counter is positioned just beyond the vaccinator, after which people are then steered to the exit. An area designated for storing material is located away from the population flow. However, it must remain within easy access of the team. Other activities can be carried out during the campaign, such as screening for malnutrition or distribution of vitamin A. The circuit must be adapted accordingly. To help organisation, the site is prepared the day before vaccination.
L'arbre, il est au milieu des tables en fait, là. Les gens qui passent là, et après les gens qui passent de l'autre côté là.
The enclosure is defined using rope or marking netting set up on pickets. When the interior of a building is spacious, such as in a village hall, ropes or netting should be used to define the circuit. The final stretch of the queue in the waiting area should be at least 30 meters long and sufficiently narrow so as to force people into single file. This system helps to control crowd movement. When the waiting area is not sufficiently shaded, canvas sheeting or netting should be installed to provide shade, along with drinking water for those waiting. If no suitable vaccination site can be identified, a tent or traditional shelter may be used as a last resort. Available on-site storage where material can be left the day before vaccination lightens the workload the following day. Waste collection and disposal must be planned before starting the campaign. The quantities of expected waste must be calculated and a waste disposal plan drawn up, having identified potential sites. All risk of infection must be eliminated. Waste must also be reduced in volume and made inaccessible to the population. One person is named to coordinate these activities. Waste must be sorted as the day progresses, at every post on each vaccination site. Syringes and needles are collected in sharps boxes. Empty vaccine and solvent vials are collected in a separate container. Waste presenting no risk of infection is collected in rubbish bins. Whether waste disposal is centralised or carried out at the vaccination site, all waste must be collected every day and gathered in a single place with restricted and guarded access. All waste is centralised for collective disposal. Particular attention is paid to the transporting of potentially contaminated waste. Specific vehicles are appointed. Preferably, waste is destroyed at a site where waste disposal means already exist, for example, a hospital or a cement works. Staff in charge of waste disposal must wear adequate protective clothing and gloves. The sharps box and rubbish bins are burned, and any residue buried in a fenced-off waste pit. The vaccine vials are crushed and the glass fragments buried in a waste pit too. centralized site is ideal in terms of making waste inaccessible and risk-free to the population. Where centralization is not possible, a waste pit is dug close to the site. It must be deep and fenced off. All waste may be burned on site. In either case, somebody must remain present until all waste has been destroyed. Once the list of people participating in the vaccination campaign has been obtained from the local authorities, job descriptions are discussed with the supervisors. It's important to have mixed teams, including those with and without vaccination experience. The training program is prepared with the supervisors. The content of the message must be adapted to each person's skills, and the practical aspects are emphasized as much as possible. The guards are often recruited on site and trained on the day of vaccination. All the personnel are brought together a few days before the beginning of the campaign to be informed of the objectives, how the campaign will unfold, the planned dates and sites, the composition of the vaccination teams, and the administrative aspects of the campaign, personnel attendance sheets, per diem payments, meals, etc. There are several training sessions. Firstly, each person is informed about his job and which site he or she will be working at. The teams are warned that flexibility is necessary as both their jobs and sites may be changed. The job profile and tasks of each person are then defined. On the training day, each member is presented with a job description, which is then explained and discussed. Role play is used to illustrate situations that teams might encounter. Going round the vaccination circuit, each job is presented to the person who will perform it, along with the material to be used and practical recommendations for its use. This rehearsal helps the team to visualize each person's role in the circuit, to be sure that the training messages have been understood, to answer any questions and to get to know each other. The coordination team members are introduced to the vaccination teams. The coordination team will typically include a campaign coordinator, a health service representative, and a medical or logistics MSF team member. This team coordinates vaccination activities and ensures good results. If the group to be trained is too big, it is better to split it into subgroups and to alternate theory and practical sessions.
On ne veut plus voir les aiguilles dans les poubelles. Il faut vraiment veiller à ça. Les aiguilles dans les conteneurs à aiguilles. Pas dans la poubelle. Pas par terre. Dans votre réceptacle.
During training, the personnel is informed of the procedure to follow in case of needle stick injury. The risks involve used injection material, the wearing of single-use non-sterile gloves is recommended. The high number of injections performed at a rapid pace accentuates the risk of needle stick injury. Auto-disable syringes are immediately placed in sharps containers. These containers are sealed and protect from injury. They must be collected systematically and burnt at the end of the day. Instructions for assembly and use must be followed carefully. One 15-litre box has a capacity of around 400 syringes, and in no case should it be overfilled. The personnel responsible for waste disposal must wear heavy-duty builders-type gloves. The procedure to follow in case of needle stick injury is explained. The wound must be cleaned immediately with soap and water and then rinsed. The wound and surrounding skin are then disinfected using either 2.5% povidone iodine or chlorine solution with a minimum of 5 minutes contact time. An evaluation is performed rapidly to assess the risk of infection. Whether a decision of therapeutic action is taken or not, the accident is declared following the instructions in the Accidental Exposure to Blood Guide.
La rougeole continue à tuer les enfants. C'est pourquoi
Informing the population is essential and must be organised right from the start of the preparation period. All existing means of communication are used to raise public awareness. The radio and religious and community leaders are frequently used.
Chère mère, vous qui aviez des enfants de 6 mois à 5 ans,
The message must be brief, precise, and must contain the following information: the name of the vaccine that will be administered, the age groups to be vaccinated, the date of the beginning of the campaign and its duration, the names of the vaccination site or sites, the fact that vaccination is free. The message must circulate in all the languages spoken in the region or country. Local authorities, such as the mayor and health authorities, broadcast the message the day before vaccination begins. In rural areas, the message should be announced a few days in advance to give people time to get to vaccination sites. The way the population interprets the message must be checked. Regular transmission of the message must continue throughout the campaign. And at the end of the campaign, the population needs to be informed of sites where latecomers can be vaccinated, as well as health centres where routine vaccination is provided.
Oui, c'était pour les mégaphones et puis les générateurs. Mais c'est bon.
A final meeting with the supervisors and others in charge takes place the day before vaccination to discuss remaining organisation issues before getting started. Well-organised logistics ensures the smooth running of the campaign. The transmission and circulation of information about practical organisation must be ensured.
On a parlé pour la vaccination demain, rendez-vous 5h45, 6h moins le quart. Je répète, pour la vaccination parce que c'est important. D'accord? Rendez-vous ici à 5h45. 6h moins le quart. 6h moins le quart. Est-ce que c'est bien clair pour tout le monde?
Le véhicule, on va prendre les carburants.